So the next question, in your view, how important is mental health in overall healing process?
I think mental health is really, really important. I think, in my opinion, I often tell people that everybody on the planet should have a therapist and be in therapy. As I said before, I think if you had a childhood, you've had some trauma, and even little traumas can get stuck, and we put in coping mechanisms to deal with them that we need to unlearn when we get older, and we don't unlearn them. We don't go back and try. But there are real mental health problems that people are dealing with that certainly need to be addressed. And as I mentioned, in the studies on depression and longevity, and overcoming your diagnosis. If you are depressed, that's understandable, but getting the help you need can help you actually live longer if you deal with that depression than if you don't deal with that depression. And so many people, unfortunately, have had traumas in their life. And I think it's really, really important to get the help that we need to uncover those traumas and to, I'm not a proponent for reliving those traumas. There are lots of ways to do mental health. You can certainly do talk therapy, but you can also do EMDR to help with trauma. You can do somatic healing to help to move things out of the body. So lots of ways to approach overcoming mental health issues and depression and things of that nature, and very important for overall health.
I'm sorry, what's EMDR?
EMDR is eye movement reprocessing desensitization. I did that wrong. Eye movement desensitization reprocessing. It is a technique that you do need a practitioner to help you with. It is very well known for helping people deal with PTSD.
Thank you. What
Mhm.
lifestyle changes do you believe have the biggest impact on preventing cancer recurrence?
All 10 of the healing factors I just went through are the biggest lifestyle changes everybody should consider and start to work on. And just remember that you don't have to do all 10 of them all at once. You can start to take small actions, baby steps in any one of those healing factors and start to make changes. The lifestyle changes, if you're trying to prevent or overcome cancer, need to be permanent. So as you work through and learn what you need to do and make it just a part of your everyday, then you can move on to the next step, the next thing that you feel you need to make changes to.
Great. How does your approach align or conflict with the principles of evidence-based medicine?
How does it align or conflict?
Yes, with the principles of evidence-based medicine.
So it's pretty well aligned with evidence-based medicine. All of the radical remission healing factors have independent research that support how it can help to build the immune system up. And while some of the radical remission survivors may have tried modalities that weren't evidence-based, modalities, they also probably have tried modalities that are evidence-based. And we are not against conventional medicine at all. We firmly believe that conventional medicine can be of great help, and that evidence-based research is really important. Evidence-based is really good because sometimes we can't get people to do studies on how effective blueberries are as an antioxidant and improving our health, right? Because nobody can afford to do a study on blueberries because they can't patent the blueberries. So having evidence, we need to balance that. We need to know that there is research that's being done, and that can really help us understand. But sometimes we need more research on certain categories, right, before we know. And we can't wait for all this research to be done, or for the study that refutes it to have another study that, doesn't, that supports it. So following our intuition and what we believe is helping us is really important. So if you believe that modality is going to help you, then by all means, go ahead and try it. But if you're spending a lot of money on things and you don't believe it's helping, or you don't know for sure if it's going to help, maybe you hold off on that. Maybe you wait and see if doing some other things can help you more. Cancer is an expensive business. It's really hard to afford all of the treatment modalities you might hear about. So be discerning and definitely look for the evidence-based modalities first before turning to and spending a lot of money on those that don't have some good results.
And how do you address skepticism towards holistic approaches in cancer treatment within the conventional medical community?
Skepticism is always going to be there. Healthy skepticism is a good thing. I think that it balances out those of us that are really optimistic and believe that these things are all going to work. And I think it helps to look at and question, like, is this really the right thing for me? The skeptics around holistic medicine, I think a lot of times, the medical community is trained to be experts in their field of expertise. They're not trained on everything else. So we need to pay attention to the fact that they're experts in that field of expertise and rely on them for that. But if they're skeptical about something else, but they haven't done the research on it, they haven't even looked at the research on it, they're unwilling to review the studies on it, then I say, don't listen to them. And I do recommend that people use PubMed. PubMed.gov is free and available for your use, and you can type in search terms related to your diagnosis and the modality you might want to try, and take that study in to your doctor and ask them to look at it. They're going to be a lot more willing to review something that comes from PubMed than something that comes from Google.
Thank you. How do you balance optimism with realism when discussing cancer prognosis with your clients?
Yeah, we talked about this a little bit, that the realism does need to be there, and sometimes my clients don't want to face the fact that they might be nearing the end. They might be at a point where the meds or the chemo is no longer working, and that things are continuing to progress, and that everything they're trying just hasn't done enough. And not everybody is going to be able to overcome a diagnosis. We all face mortality. Nobody gets out alive. Death is a part of life. And I firmly believe in embracing death and the possibility of death, because it's not just a possibility, it's a certainty. I have developed a pretty healthy relationship with death and with death planning, and with how I want to approach it. Not everybody does, and we don't talk about this a lot in our culture. It's kind of taboo. We push it away. It's a scary thing. But I think it's really important, and that's where realism often comes in. Is let's face what we're dealing with, and while there's always room for hope, always room to believe that a miracle could happen, it may not. It may not happen, and so being realistic about what's to come, so that you're prepared for it, so that your family and friends are prepared for it, so that you get a good death because you had a good life, I think is really important.
And what do you say to critics who argue that holistic treatments can dangerously delay conventional treatments?
Some people do want to try. Give me 3 months to go try it my way. And if it's not an aggressive, fast-growing cancer, then I don't feel there's a problem with that, right? Let people try it. If it's a fast-growing, really aggressive cancer, maybe that's not the best idea. And of course, those people trained in utilizing chemo and radiation and traditional medical approaches are probably going to be more skeptical and really make you feel like it is an emergency. You have to do something now. So again, following your own intuition, knowing what's right for you and being your own best advocate is important. And if you want to take that time, knowing what the risk is and weighing the risk and the benefits is really important.
Great, thank you. And how do you measure the success of a holistic approach to cancer treatment?
It is hard to measure the success of the holistic approach. Now, we have those stories in the Radical Remission book and continue to have stories of people that take a completely alternative approach and have a great outcome. But we don't have case studies documented as much on those people because they're doing their own thing and they're not being, necessarily followed by a doctor. Or when they do go back to a doctor, the doctor is like, well, okay, good for you. Keep doing whatever you're doing. So we don't have a lot of evidence and case studies that can support how a holistic approach or an alternative approach can be successful. I know that there are studies that show that an integrative approach, taking that holistic approach, using conventional and some of the alternative methodologies and bringing it together, can lead to a better outcome for people. So I don't have any of those studies off the top of my head, but they are there. And of course, you can always find studies that are going to refute it as well, but not too much study is done on a completely alternative or even a holistic approach.
And since you've been on your journey and become a facilitator, how have you seen the acceptance of this modality with conventional medicine? Have they become more receptive to this type of work?
Conventional medicine often gets really a little itchy about herbs and supplements, right? They don't know and they don't think we should do those because they just don't know anything about it. They don't get trained in it. More and more doctors are starting to look at lifestyle medicine as, a real positive thing. But not all. And I'm hopeful that younger doctors are starting to see this and that there's more influence of, doctors like, Dr. Stoll and different ones that have presented here that are actually working with conventional medical people and teaching them that things, there can be a better way and that people should be empowered to do what they can on their own. Certainly nutrition shouldn't be disputed. But I remember, 10 years ago that the conventional doctor was telling me to go eat a brownie or drink a margarita. And that was really unsettling for me because I knew that wasn't the right thing to do. But older guy was an expert in his field of expertise on breast cancer and using chemotherapy and radiation. And, he just hadn't been trained on nutrition and supplementation. So I don't blame the doctor, I blame the medical system. And I hope that the medical system can change at some point so that more and more lifestyle medicine is looked at as an important part of the healing journey.
And do you think the current cancer research and treatments adequately address the needs of patients with metastatic cancer?
Not so much. My type of cancer is, I guess, an easier one, right? It's hormone meds that are blocking hormones from feeding the cancer. Other metastatic diagnoses aren't as easy. I do know that within the breast cancer world, there's really not enough research on metastatic breast cancer. And that's the kind of cancer that we die from. We don't die from early stage breast cancer. We die when early stage breast cancer metastasizes. And there aren't enough researchers doing the work and enough people supporting that. There's a lot of support for the pink movement, right? And the buying pink products and supporting Breast Cancer Awareness Month in October, while that's all well and good, make sure what you're buying, that some of that is going towards research. Better yet, don't buy it and just put your money towards the research to help support it.
Thank you. And in your experience, what are the most common misconceptions about cancer prevention and healing?
Common misconceptions, really that that the individual can't do anything about it, right? That's a common misconception. Also, a common misconception is that we're going to die if we get a cancer diagnosis. We don't. We don't all die from cancer. Cancer is scary, and people hear you have cancer, and the panic comes up, and the belief is that we're going to die. People, our family and friends, we tell them we're going to, that we have cancer, and they think it's a death sentence. It's absolutely not. We need to switch that so it's not such a scary thing. But that's going to be really hard to change that. I want more people to know that cancer can be a chronic disease that can be managed. Early stage cancers can be a short-term disease that can be managed. And then with lifestyle change, that can help us to turn off those disease-promoting genes. And if you've had cancer once, you're a perfect host to get it again. So putting in those permanent lifestyle changes is really important. The percentage of people that get a second diagnosis, or there's lots of people that even get a second or a third primary cancer. Lifestyle changes can really make a difference in that. And I would love to see that be a bigger source of information. And I'd love to get more people looking at how do I prevent disease in general by changing my lifestyle. But so many people don't change until they get a diagnosis. And that's a really sad thing to see.
And what leaves you optimistic about how things are going with the future of cancer treatment?
I see more people speaking up about lifestyle medicine. I see more people speaking up and studying and researching other modalities. I think that, things have come a long way in the last 10 years, and I know they're going to go a lot further in the next 10 years. And that does give me a lot of hope. And I think that the more people that stand up and say, this made a difference for me, I'm empowered, the more healing stories we have, I think the more that we'll have to pay attention to it.
All right, great. And we have about a minute left. Any final thoughts that you'd like to leave with the audience?
I am just so grateful for being here and for having people here listening. And I do hope that you see how lifestyle change can make a difference in overcoming the odds. And please check out radicalremission.com. Check out our podcast, Stories That Heal.
Great. Thank you so much, Karla, for joining us today. If we could unmute the audience so they could share their appreciation for Karla.
Thank you, Dr. Karla. Thank you for taking
Thank you.
Thank you.
Thank you very much.
Thank you.